Hello, my name's Christopher South, and I have been in EMS since 1995, and I have been a paramedic since 2003. So this year marks 22 years as a paramedic, with 30 years in EMS. And the last couple of years, EMS as near and dear to my heart as it is, I truly believe the future of EMS is bleak in America unless we do something and do something fast. And I wanted to take a few minutes because it is the National EMS Week to talk about it and to give the general public an understanding of why EMS is in crisis. So this week, May 18th through the 24th, marks EMS Week. And every year there is a theme for EMS Week. And this year's theme states that we care for everyone, which is amazing because we really do. We take care of people regardless of their ability to pay. We take care of them regardless of whatever their ethnicity is, whatever their creed is, whatever their politics is. We take care of everyone, even regardless of what type of emergency we're having. We take care of everyone. And I think that's something that all of us as EMS providers pride ourselves in. However, we're not going to be able to do that for long. We're not going to be able to take care of everybody because there's just not enough resources to go around. And I want everybody to understand that your local ambulance service is in crisis. And I wanted to get it across because the best way for you to support EMS during EMS week is to start getting involved in making changes so EMS can continue. Believe it or not, EMS is fairly new in the United States. It's only been around since the 1970s. It really got started in the late 60s. Prior to that, most of EMS as we know it today was essentially you either had like an ambulance service, they just kind of threw you in the back and took off with you to the hospital, or it was the local funeral home and they had an old hearse they decked out an ambulance. We had very few pieces of equipment or anything, and it was just a ride to the hospital, and that's what you got. Thanks to a paper that came out, it highlighted the need for ambulances to be on there because of so many people dying on the highways. And this really got EMS started in the United States, which was a great thing. And there was a lot of funding here in the beginning, especially during the 70s, especially really got EMS started in local areas. And then it tapered off in the 1980s. And we really haven't had significant federal funding since the 1980s for EMS. It's kind of been the burden has been pushed off for states and especially like communities and local municipalities to take on the burden of funding it. But did you know that in many states and in many areas, the EMS is not even a necessary service like fire or police? It's not considered what's known as an essential services. And that's one of the things that we need to change in America is EMS is definitely an essential service. That is one that everybody needs. At some point in your life, there is a good chance that you are going to need EMS. And so it's important for EMS to be an essential service where it has to be mandated in every community and for it to be properly funded. But here lately, a lot of federal programs have been cut. Now, this isn't a rant or anything about what political affiliation I'm with or what affiliation you're with. It is a call and a desire to get essential services for everyone because we as EMS, we want to take care of everyone. So one of the things that has become a big problem with EMS over the years is the Centers for Medicare and Medicaid Services, known as CMS, is really who dictates the cost of services for the services that EMS provides. All right, that includes like how much we can get reimbursed for as far as the transportation costs, driving a person to the hospital, the level of billing that we can charge for depending on the services. And that funding, unfortunately, especially on the Medicaid side, does not cover what it costs an ambulance service to provide that service in many cases. And so oftentimes ambulance services are losing money on providing services for patients, especially who have Medicaid. But the thing is what if his funding is significantly diminished or cut altogether? Having some money is better than having no money. And we need to start getting appropriately funded and appropriately paid for the services that EMS provides. So recently, in the United States, the No Surprise Act was passed. The federal law protects consumers from surprise bills during emergencies or when an out-of-network doctor provides care at an in-network hospital. This law requires medical providers to bill consumers at the in-network rates. Insurers and medical providers settle billing disputes through arbitration process. It also protects consumers from costly air ambulance bills, which is great. I wouldn't want to get a really costly air ambulance bill if that air ambulance that picked me up was out of network. However, this is where it gets kind of messed up, but excludes ground ambulance transportation, as you could still get a surprise bill for that ground ambulance. And here is what is disturbing. The reason that our federal government could not figure this out is because they thought that it would be too hard to figure out between all the different municipalities, private services, and everything. They just found it to be too difficult and said, well, we'll hash it out at another date. That's ridiculous. We pay our elected officials should be working for us. This is something they should be working through and not just passing it on. 19 states do have protections from ambulance bill surprises, and they include Colorado, California, Delaware, Florida, Illinois, Indiana, Louisiana, Maine, Maryland, Mississippi, New York, Ohio, Oklahoma, Texas, Utah, Vermont, Washington, and West Virginia, which is fantastic. But a majority of the United States, including where I live, do not have that in place. So one of the things that I want to kind of go over very quickly is for people to understand what EMTALA is, and this is going to be very important toward the end of this presentation. EMTALA stands for the Emergency Medical Treatment and Labor Act, and what EMTALA is, it is a federal law that requires covered hospitals to provide screening, stabilization, and/or transfer to anyone who requests examination or treatment, regardless of their ability to pay or insurance status. Now, this was fantastic when it was first passed, is it because it prevented hospitals from refusing to take patients. That way they couldn't just close the doors on them. It's because they do need to stabilize these patients. They need to treat them. But now EMTALA, unfortunately, has become a catch-all act, is where the general public goes, if I've got an illness, I know that if I try to go to the urgent care, they may not see me because I don't have the ability to pay. They're going to turn me away. But if I go to the emergency department for the same thing, they're going to see me. They're going to take care of me regardless of my ability to pay. So the emergency department has now become the primary care physician for many people who may not have sufficient income or sufficient health coverage versus places like the urgent care and everything. And this is a lot to do because they understand that they can't be turned away. Now, this is going to be important here in a little bit, so just hang tight with me. Rural healthcare is in crisis, but this is also urban healthcare as well. So in 2023, all right, 51% of rural hospitals were within a negative operating margin. That means that they were operating in the red. All right. 30% of U.S. rural hospitals are at risk of closing. Now, this increases in the areas that are dependent upon Medicaid to fund that hospital. Now, we can see this, especially this has happened a couple of times in severely affected areas in rural Alabama and other places like that. So the more rural the area is, the less of the income that may be in that area, maybe because of factories closing down, agriculture not being as predominant there anymore. In these areas, when that funding is lost, the hospital shuts down. Well, if the hospital shut down, those people still got to get health care. Just because you shut the hospital down doesn't mean that these patients go away. It's not the way this works. What happens is immediately that burden from that hospital being shut down is diverted over to EMS. And that diverted patients who would normally be seen at that local emergency department, local hospital, are now having to be transferred further and further away to care. And so that puts a longer time that an ambulance is unavailable. And because of this, people die. People absolutely die because of rural healthcare crisis. And something has to be done about it. So here are some of the challenges to staffing an EMS agency. Now, this is based in Wyoming. One of the big things that has become a huge problem now, when EMS first got started, a lot of programs were basically volunteer agencies, as where they depended heavily on volunteers. Now, I live in a rural area of Iowa, working in Iowa. I also worked in Minnesota. I've worked in North Dakota and different places around. And volunteer agencies are still the backbone of many of these rural programs, is having volunteers to staff that ambulance. But now, especially after COVID, getting volunteers is fewer and fewer. We're just not getting the numbers. Number one, you got to put them through school, and a lot of people don't want to go, I'm not going to volunteer and have to take a course that's going to take me 3 months to go through and have to study my tail off to pass it. And then what's in it for me? And I totally get that. The next thing, it's a big barrier, is funding for operations. Now, is hopefully you're getting, a pretty good payer set where you're getting, a good mix of payers from Medicare, Medicaid, and private insurances. But if you're in an area where a majority of your payers are either Medicare or Medicaid, it makes it even harder to keep that funded. The next thing is wages, especially after COVID, and we've started to see that people are leaving the profession, myself included. All right. I'm toward the end of my EMS career now, is because I've already started off into nursing, is because there's no money there for me to be a provider. It's just not worth it anymore. If I can go to school for the same amount of time and be a nurse and make a lot more money, and there's a lot more advancement that's there for a paramedic, they're going to go for that. And so wages keep increasing, unfortunately, for ambulance services, but it's still not enough to maintain providers. It has gone up in recent years, but it's still not enough to retain staff. And that money has to come from somewhere. If we're not getting that money from payers such as the CMS and private insurance, then there's not enough money there for these services to be able to pay in wages to keep qualified staff. And it just keeps going and going and going. And two other areas, of course, are being in a rural area. It's hard to attract good staffing when it's in a rural area, and of course, billing difficulties. This is not just in the rural area, this is everywhere. These are news stories from all across the country of ambulance services that are closing due to lack of funding, closing due to lack of staff. And this is a cascade of events that's just going to keep on going until we as a country step up and say EMS has to be appropriately funded. In the United States in 2023, Medicaid covered about 1/5 of all spending on hospital care. So we can see that if we look at what distribution of spending on hospitals by payer in 2023. Now, this is based on hospitals that have a good payer mix. Now, this isn't on a hospital that is very dependent on Medicaid and Medicare, but this is and we see that there's about out of pocket is about 3% of your payers. Private health insurance is 37%, Medicare is 25%, Medicaid is 19%, other third-party payers is 10%, and other health insurance programs about 7%. What happens if we take 20%, which is Medicaid, and reduce that 20%, or we take it away altogether. Do you think hospitals are going to be able to continue to offer the services that they're having, or are they going to have to cut things at the hospital? What about ambulance services? Are they going to have to start cutting things when their budget is razor thin and there's no room for them to cut? So let me tell you what does get cut. What gets cut is being able to properly staff, is because there's not going to be enough money for raises. There's not going to be enough money to add extra units, extra equipment. The equipment is going to be outdated because they can't afford it. These are things that affect you, America, as a whole, and we need to do something about it. In the last few months, we've been talking more and more about Medicaid cuts. And for some people, they think this is a good thing. It's not. What we need to be doing is not doing Medicaid cuts, but we need to be expanding Medicaid. Now, what I would like to see in America, which most people are going to laugh, is I believe that we need to have universal health care in the United States. It works well for our European partners and places all around the world. It can work here as well. But in the meantime, we need to expand Medicaid, is because if we expand Medicaid, places that rely on this funding to be able to operate at the bare minimum need this to stay open. Because if not, if we don't expand Medicaid, people will die. Just like any examples that I gave earlier. It's needed. We absolutely got to have it. So we talked about EMTALA just a minute ago. So where are these people going to go? Where will they go? So we have patients that we cut their health care. We take away their Medicaid. Do you think they're just going to sit at home when they're sick? No, of course not. They're going to end up at the hospital. But instead of being able to have Medicaid and to be able to go to that urgent care to be seen for their, chronic conditions, maybe they have diabetes, COPD, what have you, this gets cut, they're going to end up at the emergency department. The emergency department, you're going to see the extended wait times, which we're already seeing. You're going to see ambulances that are held up. You're going to see, because they're going to call more for the ambulance to take them to the emergency department, because a lot of people think that you can get seen quicker and some things like that. And so it becomes a big, huge snowball event once you cut that funding, is it affects every single portion of our healthcare system. Everybody loses when we cut Medicaid. So how can you help? The first thing is to write to your congressman, your senator, the president, whoever, is to, number one, promote the expansion of healthcare in the United States. And the first thing is to make sure that Medicaid is expanded, and so we can get healthcare to the people who need it the most. The second thing is to ensure that EMS is properly federally funded. For every city in the United States should have EMS that is federally funded to be able to take care, because as Americans are getting older, the more services are needed. And the last thing that you can do is to support your local EMS. And you can support your local EMS, is like a lot of them are volunteer organizations, is to support them through their fundraising drive when they're trying to get equipment or to raise money to be able for their operating budget. And you can also support them as when there's meal levies that's brought forward in your community to help support the ambulance. You need to vote yes, is because you will one day need that service, or somebody you care about may need that service. And finally, if you're up to it and think that you are ready to take that big leap, volunteer. You could volunteer in a lot of places just to be an ambulance driver, get your CPR certification. It's a huge help. Or go through EMT school. It's a great way to give back to your community. So on behalf of everybody working in EMS, happy EMS week. And I hope that this was informative and that you have taken a couple of minutes of your time to learn about how you can help EMS and to see the disastrous state that EMS is in. Thank you so much for your time.